Collecting a blood spot sample is a rather simple procedure and should take you no more than a few minutes to complete. To ensure the accuracy of your test, make sure to review the collection chart on the instructions that came with your test to determine when you collect your sample. Men and children can collect on any day of the month, and women will need to determine test days based upon their menstrual cycle if they are testing hormones. Women collecting for thyroid testing or heavy metals and nutrients may do so on any day of the month. For cardiometabolic testing, you may be doing a fasting test. Please refer to the special instructions on the included sheet if you are currently using hormone treatments. Hormone users need to plan their supplementation doses for certain tests. Topical hormone users should continue using hormones daily as usual, but should avoid applying hormones with their bare hands during the 3 days prior to collecting blood from their finger. For example, hormone creams can be applied using gloves, or applied directly from the tube to the wrists, and the wrists rubbed together while the cream is absorbed. Here are the key steps to a good collection. First, prior to handling the contents of the kit, wash your hands with soap and dry them with a clean towel. Next, lay out the materials that came in your test kit. All test kits have a single blood spot card, except the fertility kit, which has 2 blood spot cards. Refer to the instructions in the fertility kit for details. You will need the alcohol and sterile gauze pads, the lancet used for drawing blood, the blood spot card, and the bandage. Print your name, date, and time of collection on the blood spot card. Next, pick up the collection card and fold the cover back and away from the collection filter paper. Make sure not to touch the filter paper. Tape it to a low surface, such as a table or sink basin, with the inner collection filter paper facing out. Keeping your hand low in relation to your heart encourages blood flow during collection. Open the sterile gauze and alcohol pad so that they are ready for use. At this point, you may find it helpful to do a few jumping jacks to get your blood flowing. Wash and dry your hands again, and then use the alcohol pad to wipe the fingertip to be used for collecting blood. It's best to use the inside tip of the middle or ring finger of your non-dominant hand. Remove the cap from the lancet and position the end against the inside tip of the finger. Press the lancet firmly against your finger until it activates. You should hear a click. Quickly wipe away the first drop of blood with the sterile gauze. Next, position your finger over the blood spot card. Gently milk blood from the finger. This can be done by applying gentle stroking pressure down toward the end of the finger. Do not over-squeeze the finger, as this can shut off blood flow. When the blood drop is ready to fall, gently touch the tip of the drop to the filter paper. Do not press the finger against the filter paper. Place only 1 drop per circle. Each blood drop should fill at least 3/4 of the circle and soak through to the back of the card. Continue to collect blood until all circles are completed. If blood stops flowing before you have collected enough drops, firmly wipe the lanced finger with the sterile gauze. This should help get the blood flowing again. Use the second lancet and another finger if needed. Once you have collected the blood spots, leave the card open and let the spots dry for at least 30 minutes. Once dry, close the flap over the blood spots. Finally, you'll need to complete all sections of the test requisition and sign your form. Be sure to include the collection time and date, as well as your date of birth. It is important to indicate any current hormones or supplements on your requisition form. If you are unsure of the dosage, please consult with your physician or pharmacist. Premenopausal women, please remember to include the first day of your last menses in Section 2. Place your blood spot card and the completed test requisition form back inside the test kit. Snap the lid shut. Place the entire test kit inside the return packaging. Attach the provided prepaid label or other postage if required, and then return using the appropriate carrier. Here's a quick look at a blood spot card done correctly. Here's a look at a sample not done correctly. If you have any questions regarding your collection, please call or email our customer service department.